Hi, everyone. My name is Diego Ortiz, and welcome to Stress and its Impact on Heart Health, a community conversation presented by the American Heart Association and sponsored by Stony Brook Medicine. Everyone feels and reacts to stress in different ways, and how much stress you experience and how you react to it can lead to a wide variety of health problems. So that's why it's critical to know what you can do to manage your stress to treat and prevent heart disease. And that's why in just a moment, we'll hear from three Stony Brook Heart Institute physicians. We're going to share some tips and tricks to help us better understand how to manage and prevent stress to improve our heart health. First, we'll hear from Dr. Robert Pio, who's going to talk to us about the difference between a panic attack and a heart attack. Next, we'll hear from Dr. Eric Rashbach, who's going to tell us what to do if your heart skips a beat. And finally, we'll hear from Dr. Joseph Franco, who's going to share tips on how to reduce your stress to protect your heart health. It's going to be a great conversation, and I'm so excited to first welcome Dr. Robert Pio. Well, I'm so excited now to welcome our first guest to our stress and heart health conversation, sponsored by Stony Brook Medicine. Why don't we have Dr. Pio? Let's see if his camera's on. There you are. Hi, Dr. Pio. Good
Hello,
day. How
hi,
are you?
good morning. Good morning.
So, Doctor, why don't we start? Why don't you tell us a little bit about who you are and what you do at Stony Brook Medicine?
Yeah, good morning, Diego, and everybody who's watching. It's a pleasure to be here to talk a little bit about heart health. My name is Dr. Pyo, and I am the director of interventional cardiology at Stony Brook University Hospital. So I'm a physician who treats patients who have blockages in their heart. For example, patients who are undergoing a heart attack with stents. I've been here for about 6 years, and again, very pleased to be with you this morning.
No, it's my pleasure. And the thing that I really wanted to start the conversation with is drawing the line between what is a panic attack versus what is a heart attack, and how do we tell the difference? So why don't we start with that? What is a panic attack, and how do you treat it?
Yeah, that's a great question, and it's a very relevant question in that the symptoms between a panic attack and a heart attack are very similar. So it's very important that we distinguish the two. And I'm sure we'll get more into this, but you have to identify what you're having so you get the appropriate treatment. Now, panic attacks happen to be very prevalent in the United States. It happens more often than you would think, possibly. And well, panic. So, what is it? A panic attack is a sort of an anxiety disorder where, quite literally, you have a panic attack. And the panic attack can manifest by symptoms. Often the symptoms occur very abruptly. They can include palpitations, chest discomfort, shortness of breath, dizziness. You could even have excessive sweating, which we in the medical world call diaphoresis. So these panic attacks can come sometimes without warning, sometimes with warning, and there are certain treatments for these panic attacks.
As you're describing what a panic attack is, I'm also hearing that there's so many similarities with the way that a doctor might describe a heart attack. So how would you describe a heart attack, and what are some of the similarities, and what are some of the things that make a heart attack unique?
Yes. So a heart attack is caused by a sudden closure of a blood vessel. And because the heart is starved for blood flow, you're going to have symptoms. Now, some of these symptoms, however, are going to mimic um, the symptoms that you may have during a panic attack. For example, you could have chest pain, you could have shortness of breath, you could have excessive sweating like diaphoresis, You can feel your heart racing, which we call palpitations. That's a feeling of your heart beating very, very fast. Um, Now, there are some distinguishing features, and this is very, very important because the treatment for a heart attack is going to be very, very different than a panic attack. Um, the cause of these two different um, entities are also very, very different. A panic attack is a anxiety disorder. I guess it's more psychological, if you will, whereas a heart attack is actually a blockage in a blood vessel that needs to be treated emergently and immediately, or you're going to get into some life-threatening complications. Um, Distinguishing features. For panic attacks, many of the symptoms that arise immediately tend to dissipate over time, whereas with a heart attack, these symptoms persist. And without treatment, in fact, it can get worse. All right. The quality of the chest pain can differ between a panic attack and a heart attack. In a panic attack, the chest pain is described as having a sharp character, whereas in a heart attack, it's often described as more of a pressure-like sensation. Um, I guess the circumstances are a bit different as well. In many cases, but not all cases of panic attacks, there's often a trigger. If you have a certain condition that promotes a panic attack, I mean, well, in that circumstances, you'll feel these symptoms. A heart attack, obviously there's no identifiable stressors, if you will, that bring on the symptoms. Uh, It's more that suppose you have certain medical conditions and you happen to be an older individual who have hypertension, who have diabetes, you have certain risk factors. You don't have a history of panic attacks, but you have symptoms, right? Then that's a distinguishing feature, I suppose, that would make you think, well, maybe this is more of a heart attack than a panic attack, all right? Other symptoms, distinguishing features in a heart attack, you would have what we call radiation of the chest discomfort to other areas of your body. You could have a radiation that is a shooting sensation down your left arm. You could have radiation to your jaw. These are less commonly talked about in patients who are undergoing a panic attack.
Something that I always hear people say, and I think it's really good advice, is that idea of don't self-diagnose, right? So how do you do that? How do you know, okay, I should seek medical help? This is more than just a panic attack. This is
Mhm.
getting even more serious. When should you seek medical help?
Right. I mean, that's a very, very, very good question because the consequences of missing a heart attack, it can be catastrophic, could be life-threatening if a heart attack is not treated immediately. Some of the distinguishing features, I mean, we talked about them, but always, give yourself the benefit of the doubt. So if you're thinking, could this be a heart attack? Don't just let yourself be talked into thinking, nah, it's not a heart attack, it's a panic attack. If in doubt, seek medical attention. In fact, I would say that if you're having these symptoms for the first time, I would say that a practical approach is to seek medical attention, get the diagnosis. And then let's say you have an official diagnosis of a panic attack, then for future episodes, right, if you have symptoms that are very, very similar, right, to the one that you had during your first attack, then you could say, well, maybe it is a panic attack. But again, I just want to emphasize here, some of the distinguishing characteristics. These are things that, we in the medical world say, yes, this is how we differentiate between the two entities. But always, always give yourself the benefit of the doubt, especially if you're experiencing these symptoms for the first time.
And something else that we see a lot at the American Heart Association, especially through our Go Red for Women movement, is we want to empower women to be their own advocate. Oftentimes, we hear stories of people, women being told that they were misdiagnosed when told it was a panic attack or they're having an anxiety issue, or it turned out to actually be a heart attack. How do we encourage more people to be their own advocate, to speak up and really speak with their doctors about their symptoms to make sure that if it is something more serious, they're getting the proper care?
Right, right. You know, women, and I might include, older patients, they have atypical symptoms. When they seek medical attention, and sometimes maybe it's something that they read on the internet too, possibly about symptoms of a heart attack, and then they compare their symptoms with what they read on the internet. And the point that I would like to make for women and for older patients as well, that, does the classic symptoms that you read on the internet may not apply to you because you have what we call atypical symptoms. You might have chest pain that is sharp, but for you, it may be a harbinger of a heart attack. You may have symptoms as just feeling fatigue, or you may feel a little bit nauseated. These are all what we call atypical symptoms. And what we mean by that is, or non-specific, is that yes, they could be due to a heart attack, but they could be explainable by other things. And, for the purposes of this talk, you know, they may be because you're having a panic attack. However, it's important to realize that certain groups of people have atypical symptoms. Um, in terms of your discussion with a physician, I think that you have to impress upon the physician how serious these symptoms are. These are symptoms that did not happen just once. They're recurring symptoms. And, even if you had these symptoms for the first time, to say how serious these symptoms are. And, you have to be an advocate for yourself. If a physician tells you something quite honestly and you are uncomfortable, I think that most physicians welcome the idea of their patients who have differing opinions to seek a second opinion.
Well, doctor, thank you so much for talking us through some of the differences between a panic attack and a heart attack. I mean, just to emphasize some of the points of knowing your body and getting the right diagnosis. Just remind us, how important is it to get the right diagnosis?
Yeah, yeah, I mean, that's a very, very important point in that we have to know our own bodies. If something is not sitting well with us, or this is something that you have never experienced before, and you just feel like, something's going on. I mean, you have to be your advocate. And salient to the conversation this morning, we are talking about making sure that you are not having a heart attack, because if a heart attack is missed, the complications that could arise from not treating a heart attack could be catastrophic. It could be life-threatening. And therefore this is something that you do not want to miss. All right. And if there's any doubts, again, I can't emphasize more. If there are any doubts, give yourself the benefit of the doubt and seek medical attention.
And the last question I want to ask is, so we're asking all of our guests today, we want the attendees or folks who are listening to walk away with some tips or things they can practice at home. How do you manage your own stress? What are some of those things that you do to bring down your
Yeah,
stress levels?
yeah. I think this is a very open-ended question in a way because there's many, many ways you can reduce stress, and I think uh, the bottom line is you have to find your own way. Personally, for me, what I do is I think exercise is a great way to reduce your stress. When you exercise, I think you get release of endorphins. Your blood pressure, it's been shown that your blood pressure over time decreases, your metabolism goes up, you feel more energetic. I think daily exercise not only relieves your stress, it's also good for your cardiovascular system. It's good for your overall health. Um, the other thing is, look, we live in a complex world. You always try to find a way to keep a positive outlook on life, I think is very, very important. And there are things in life that you love to do that I think that as we get older and as we get busier, we tend to forget them. You look back, when you were in college or, when you were younger, that this is something that I really love doing, right? But then you just never do it now because you don't have the time. And I think it's important, once a week or once every 2 weeks. I know we are all busy to find that thing that you really like doing, that really fires up your passion. And to do that, I think you need to find time to do that for yourself.
I love it. That's great advice, and that's a great place to end our segment. So, Dr. Peel, thank you so much for joining us. I hope you'll stick around and listen to the rest of our conversation. We know there's going to be some nice takeaways for everyone to practice and to manage their stress. So, thank you again, Doctor.
You're welcome. It was a pleasure.
Well, thank you again to Dr. Pio for talking to us and really explaining the difference between a panic attack and a heart attack. I'm really excited now to welcome our second speaker of the day for the segment that we're calling When Your Heart Skips a Beat. So why don't we welcome Dr. Eric Rashba. Dr. Rashba, welcome. Why don't you tell us a little bit about yourself and what you do at Stony Brook Medicine?
Thanks. It's a pleasure to be here. So I'm a cardiac electrophysiologist. I specialize in treating abnormal heart rhythms. So I'm director of the Heart Rhythm Center here at Stony Brook Medicine, which we started over 17 years ago. So right now we have a big group. I have 3 other physicians who work with me and a large core of support staff that help patients both in the hospital setting and as well in the clinics.
When we talk about treating heart disease, we often talk to cardiologists, but it's unique that we're speaking with you as an electrophysiologist. Can you tell us what does a cardiac electrophysiologist do, and how is it maybe similar or different than what a cardiologist might do?
Yeah, so we tend to get patients referred from cardiologists mostly. So we specialize specifically in the electrical abnormalities of the heart. So slow heart rhythms that may need treatment, symptoms such as palpitations or fainting are common problems that we evaluate. And also fast heart rhythms, which can either be benign and just a nuisance or potentially dangerous. We also evaluate patients who are at risk for dying suddenly and try to implement preventive therapies for that.
Oh, that's amazing. So you work in tandem with the cardiologist to help treat patients to the best of your ability using the science and technology that's available.
Yeah, that's correct. Most of the time we work together with a general cardiologist as a team.
Well, that's amazing. Now, you mentioned some of those common heart palpitations. What are those common palpitations, and are they dangerous?
So a palpitation is really a symptom. It's when somebody feels an irregular heartbeat, something doesn't feel right with their heart. It's not chest pain or pressure, which probably Dr. Pio talked about, but it's like a fluttering in the chest, something that feels abnormal with the heartbeat. And it can literally be anything. Some people are just more sensitive to the normal heartbeat, so their normal set point for heart rate might be higher, and that's bothersome to them. So there's a syndrome called POTS, or postural orthostatic tachycardia syndrome, that a lot of patients have unfortunately contracted after getting COVID infection. And those people tend to not have an actual arrhythmia, but when they stand up, their heart races. It's not an arrhythmia per se, but it's a normal rhythm, but they feel palpitations. So palpitations can also be from skipped heartbeats. So the normal electrical system is starts, there's a pacemaker area in the right upper chamber of the heart and a specialized cabling that runs through the center to the bottom. So it's usually very coordinated, the normal heartbeat, starting in that pacemaker area, going down through the normal cabling of the heart. If people have extra beats, which can happen from an irritable area, either in the top chamber or the bottom chamber, that can also cause palpitation. Or sometimes people can also have like a sustained rapid heart action, which can be abnormal rhythms from the top or bottom chamber as well.
You also mentioned the term arrhythmia. I've heard that before, kind of know the loose definition, but what is an arrhythmia and how common are they?
Yeah, so it's an abnormal heart rhythm. So something that's basically coming from outside the normal cabling of the heart that I mentioned. There are lots of different ones. That's kind of an all-encompassing term. The most common arrhythmia these days is atrial fibrillation. It's more common as you get older, also with other conditions like high blood pressure, diabetes. Among seniors, it's about 10% of them actually have atrial fibrillation. So that's really the most common one. So atrial fibrillation is an irregular heartbeat that comes from the left upper chamber of the heart, and can be associated with clots forming in the heart and causing stroke and also causing symptoms. So there's numerous things we can do to treat that. So in terms of how common other things are, I mean, they tend to be common to me because that's all I do. But in terms of percentages of people that have them, there's probably below 10%, descending order from atrial fibrillation.
Now, in a minute, we're going to talk about the effects of chronic stress, long-term stress, and how that might hurt someone's heart health in the long term. Can living with an irregular heartbeat for a long time lead to something worse as well?
Yes, it can. And again, it depends what it is. In the case of the most common one, atrial fibrillation, if it's not treated properly, you can have clots form that can cause stroke. So usually we recommend blood thinners based on people's risk profile. Also, if the heart rate is uncontrolled in atrial fibrillation, that can actually affect the pumping function of the heart. So people can actually develop congestive heart failure, shortness of breath, low pump function of the heart over time. So sometimes other arrhythmias, so premature ventricular contractions, which are skip beats from the lower chamber of the heart, if they're frequent enough, they can also affect the heart function. Usually it's the more incessant arrhythmias, the more frequent they are, the more likely they are to cause a problem like that over time.
You've mentioned atrial fibrillation a few times, and the American Heart Association, American Stroke Association, we do have campaigns to increase awareness in AFib. Can you tell us, what does the research say? What does the literature say about what communities or what demographics might be more likely to have AFib?
So there's a number of risk factors. As you get older, you're more likely to get it just on that basis. Hypertension, so high blood pressure, can increase stretch in the heart and dilate the left atrium, the left upper chamber of the heart. The bigger that chamber is, the more likely people are to go into atrial fibrillation. Diabetes is also something that may predispose people. So obesity tends to also be a risk factor. And actually, there's good evidence now that, physical exercise and losing weight can actually help atrial fibrillation. And a related problem, obstructive sleep apnea. So people who are overweight can often close off their airway at night when they're sleeping, and their oxygen level can go down dramatically when that happens. That also, is part of our kind of basket of lifestyle modifications that we try to treat atrial fibrillation with, in addition to the medical interventions that we do. Treating sleep apnea appropriately with, it's called positive pressure ventilation, or CPAP, basically to prevent the airway from closing during sleep, has been shown to reduce the amount of atrial fibrillation as well. So there's a number of different things. Also, alcohol, avoiding alcohol is very important. Too much alcohol can also trigger atrial fib.
The common thread throughout our conversation today is sharing tips to help manage stress. So can you tell us, can stress cause an irregular heartbeat, and how do we prevent it or manage it?
That's kind of a hard thing to actually prove in any individual patient or, in a study. I guess you could self-report how how much stress people have, but it's hard to like randomize people to half having stress, half not, and seeing what happens. Yeah, we do know that some arrhythmias are kind of driven by increased adrenaline, which can be caused by stress. So those premature ventricular contractions that I spoke about, that can be increased by, anything that increases adrenaline, exercise or stress can do that. Also, something we haven't talked about yet, supraventricular tachycardia, which is an extra circuit in the upper chamber of the heart. Again, anything that increases adrenaline that can kind of throw people into that rapid heartbeat. When we're actually testing, when we do procedures in the electrophysiology lab, we actually give isoproterenol, which is similar to adrenaline. It kind of mimics the stress state in order to bring on the arrhythmia so we can track down where it's coming from and get rid of it.
I mean, it's amazing to hear about all of the advances that exist and that have been made to really better help us understand how the heart works and how we can help people live longer, healthier lives. But I want to know is, when should someone think about seeing a doctor like yourself? Is that something that they would make a decision on their own? Would they speak to a cardiologist? How do they get to you?
I mean, some people get to me directly. Some people go to a cardiologist first. One of the things we're exploring is whether or not to have actual symptom-based clinics, like you've mentioned palpitations a few times, to have like a gateway for patients to enter with that symptom, perhaps be triaged by a mid-level provider like a nurse practitioner or a physician assistant, and then get routed appropriately, if we document that there's something actually going on. But certainly if you're diagnosed with, a definite arrhythmia like atrial fibrillation, that you're better off, you should certainly see a cardiologist, but, the experts are electrophysiologists in terms of dealing with that. Supraventricular tachycardia as well. I would say frequent premature ventricular beats. If that's come up as a diagnosis, even from a primary care physician, it's worth seeing an electrophysiologist.
Well, doctor, we're so grateful that you're here and that you're able to join us. I'd like to give you an opportunity for a last word by maybe sharing a little bit about how you manage your own stress.
Well, I do like to exercise, so I do a lot of yoga. It's not the kind of yoga where you kind of sit and do Om all the time, but it's, vigorous physical exercise is a good stress release. And yeah, yoga is my form. I like getting outside. I like hiking. When I take vacations, I tend to go on hiking trips, try to see new places while I'm there.
Oh, I love it. Those are among my favorite things: mindfulness, travel, and obviously spending time with our loved ones. So, Dr. Rashba, thank you very much for joining us once again. In just a second, we'll be back to hear from Dr. Joseph Franco.
All right, great. Thanks for having me.
This has been a great conversation so far, and I'm so excited to continue by introducing you to Dr. Joseph Franco. So, Dr. Franco, welcome so much. Welcome to this conversation. Why don't you tell us a little bit about who you are and what you do at Stony Brook Medicine?
Excellent. Thank you so much for having me. It's a pleasure to be here. I'm a community cardiologist near Stony Brook, and I have an outpatient practice where we do general cardiology, risk assessment, and as part of Stony Brook's community network.
Well, that's great. And I'm sure you see a lot of patients. I'm sure they ask you a lot of questions. So I don't think we're going to surprise you with any of the questions we're going to ask you. But the conversation, the topic is stress. How do we reduce stress and how do we protect our heart? So first, how does stress affect your heart?
So, when you think about stress and the heart, we try to think about the long and the short-term effects. In the short term, stress increases the stress hormones like adrenaline and those catecholamines. And what that does in the short term, it causes a vasoconstriction. So it raises blood pressure, increases heart rate, it increases irritability of the heart muscle. And so in the short term, you can feel crummy from a sudden onset of stress. In the long term, it's more the long-term stress hormones like cortisol that they increase these inflammatory proteins like the cytokines and interleukins. And what that does over time is it leads to progression of plaque, early atherosclerosis or coronary heart disease. So it can, in the long term, managing stress can be really, really helpful.
So stress actually has a physical effect on your heart, is what you're saying. And so you were talking a little bit about the short term and the long term. So we sometimes hear that term chronic stress, right? So I believe that's that long term or stress sustained over a long period of time. Tell us more. What is the difference between stress, everyday common stress, and chronic stress?
So think, short-term stress is how I felt preparing for this interview. Short-term stress is I want to get this right and I want to make sure I'm giving the right information. And it made my palms sweat a little bit. I got a little bit of that feeling in my gut. And I think most of us in our lifetimes are going to be exposed to acute stress. And it actually sharpens you a little bit. And when you think about trying to go out and do the best you can, having a little bit of stress on you actually helps you. It makes you perform a little bit better. Long-term stress, it's just how you deal with that stress, and long-term stress is, think about, caring for a loved one. It's that fight or flight, but it's sort of turned on to a low level for a prolonged period of time. And that has these psychological and physiological changes. It's one of the reasons that we think that police officers and firefighters are at a higher risk of cardiovascular disease over time because they're exposed to that chronic stress. They're sort of always turned on, scanning the horizon for danger.
And what is the risk of living with that chronic or long-term stress?
It leads to that early development of coronary heart disease, and including heart attacks.
So it sounds like some stress is good for you. It might inspire us to perform, to be in the moment, but long-term sustained chronic stress can lead to some of these more dangerous heart emergencies. Yeah, is that accurate?
And I'll give you an analogy that I love, and we all manage stress differently. We all deal with particular stressors differently. Something that might make me really anxious, like an interview, you bat off because this is your job every day. And I'll give you an analogy I really like. Scientists build these terrariums, these biodomes, and they say one day we're going to put one on the moon, and we're going to have rocks and trees and gardens. And so they built these terrariums, and they found that the trees in the biodome wouldn't grow as tall, and they listed a little bit. They couldn't figure out why did the trees not grow the way that they did in the natural environment. And what they found out is that trees need to be subject to wind. And you can draw that comparison of wind to stress in your life. So when you're exposed to wind, you get a deeper root structure, and you can better you actually grow taller. And I think in your own life, if you can look at that and say, look, I'm dealing with this stress, but I'm going to deal with it in the right way, and it's going to make me grow taller. It's going to improve your life.
I like that analogy a lot. It reminds me a lot of the conversations that were happening about grit and how important it is to have some of those obstacles that you overcome in your life to help you build those skills so you can endure for the long term. So we know that stress is a part of life every day. We experience it: financial stress, work-related stress, environmental stress, in traffic, you name it. What are some healthy ways that we can reduce and manage our stress to better deal with it?
Yeah, I think, you try to think about stress as having a frequency, an intensity, and a duration. So if you can manage it in a way that reduces the frequency of the episodes, the intensity, how severe it is, how much it affects you, and how long those episodes last, that's how you're going to better manage it, I guess there's basically 4 or 5 broad categories that I was thinking about. And I think probably number one is exercise. We know that exercise dramatically reduces stress, and it improves our response to stress. I think a lot of times people get intimidated by exercise and they think they have to go out and do CrossFit, and that it just doesn't seem to be the case. The American Heart Association defines moderate intensity exercises where you can hold a conversation, but you can't sing a song. And so if you think about that, if you're out there and you're huffing a little bit, but you're able to still get the words out, that's exercise. And that we know sort of down regulates all those stress receptors, the adrenaline receptors, and improves function. Number 2 is don't smoke or drink it to excess. I can't tell you how many times patients come into the office and they tell me, I smoke because I'm stressed. I mean, it's such a crutch. But if you think about it, I mean, nicotine is a stimulant, right? It turns on that fight or flight. And so avoiding smoking definitely is going to help. Diet is really important as well. When you're eating healthy, when you're eating clean, your brain works better. And I think most people who have gone through eating right versus periods where they sort of fall off the wagon, they'll tell you that their brain works the best when they're eating right. Another category is that connection with something larger than yourself. And that I think you can get there through prayer, meditation, mindfulness, and breathing, breathing exercises. And the last would be, there are some situations where medications are helpful. For situations where you absolutely have to put the fire out and you can't manage the stress with conventional ways.
I love that you really gave us a whole spectrum of ways that we can be proactive of managing our stress, from, movement to what we eat, to maybe some things that we shouldn't do when we do get stressed, and to, having that conversation with your doctor about getting the right medication when it's appropriate. I think often about how do we remove that stigma of identifying and talking about stress and talking about mental health. How important is it to get rid of that stigma, debunk those myths that you can't be tough or macho, especially for men, and have conversations about stress and mental health? How do we debunk that myth?
Yeah, I mean, I think it really comes down to allowing ourselves to rely on others and realize that no man is an island, and if you can connect with someone, and it's another part of this is the idea that when you are engaging socially, you're actually also doing a lot to reduce stress, because there are a ton of studies out there now showing that you get dramatic improvement in heart health when you are socially connected. The relationships and connecting with others, whether it's a physician, a psychologist, or family, friends, social network, they not only keep us happier, but they make us healthier. There were some fascinating articles I read as I was preparing for this, where they pointed out the risk of heart disease, of atherosclerotic heart disease, including heart attack, is 3 times higher in folks who describe themselves as socially isolated or have marital or work related chronic stress. And they even compare it to smoking, that in terms of heart risk. So your risk of atherosclerotic heart disease in folks that self-describe as under stress was equivalent to smoking 15 cigarettes a day. So it's it's pretty dramatic how important that connection is.
I like what you said too. No man is an island. We all have, whether it's family or we're parents with kids, different ages ourselves. How do we help our family members and maybe young children manage stress and be open to talking about managing stress?
I think it has to do with just making connection. You know, the when you listen to someone, when someone feels listened to and they feel that connection, it is really therapeutic. There really is something to making that connection and validating feelings. You don't need to run out and solve the problem. It's a sort of an old trope. It's like, I don't want you to solve my problems. I just want you to listen. And it turns out that when you listen and when you actually do that, not only is it good for the person that you're listening to, but it's really good for you, you know?
I agree completely. I agree completely on both ends of the conversation. One of the last questions I want to ask you is, something I recently heard on the radio is that, we as humans, we know that when we're thirsty, we should go drink water, but we don't always know what to do when we're feeling lonely or feeling down. That maybe the solution might be to reach out, be social. Right. So how important, let's hammer this down. Like, how important is it for us to stay social and connected?
Oh, 100%. I think we look sometimes at stress or at loneliness as a problem in and of itself. And maybe it is more of just a signal. It's your body telling you, hey, reach out and get that connection, reach out and ask for help. And, sometimes I think about stress in my own life. I put all my stress in my left hand, work aggravation and bills and who's punching who on the playground. And in my right hand, I put all the things that balance the scale out, like the things that I like cooking and fishing and connecting with my family. And I always try to keep that scale tipped a little bit towards the right.
I love it. And you gave a few examples, but I want to learn a little bit more. This is our last question of how do you manage your own stress? How do you manage stressors in your own life?
Yeah, I mean, it's one of those things. All day long, I tell people about exercise and diet, and it's a struggle, I think, for everyone, myself included. But I find that when I stay focused and I stay mindful and I stay in prayer and I stay connected to my community and my family, um, that scale it drops in my right hand when I allow myself to make that the most important thing. And the stress is always there. There's always going to be something to balance the scale out. But the more I fill the right hand, the better things go for me.
Well, Dr. Franco, I really appreciate your time. You shared so many great tips with us over the last 15 minutes. For all of our viewers, we want to thank you for joining this conversation. We'll give one more thanks to Dr. Pio, Dr. Rashbach, to you, Dr. Franco, and we want to thank Stony Brook Medicine for sponsoring today's conversation. This is such an important topic. It's something that is relevant year-round. We want to encourage you, if you feel that you need help after long-term stress, there's so many things that you can do to take control of your health. On behalf of the American Heart Association, thank you. Take care of yourself, and we'll see you soon.